Welcome back to Quick Take Charge. I'm Jennifer Zabasaja.
And I'm Tim Stenevec in New York. It's time now for Quick Take by the Numbers. It's where we give you the numbers that tell the story. This morning's number is 300,000. COVID-19 cases appear to have peaked in India, but it has now killed more than 300,000 people in the country. Almost 4,500 people died over the past 24 hours, and fatalities continue at near record levels. India reported 222,315 new coronavirus infections on Monday, the lowest since April 16th. That's according to government data. Local media reporters, though, cite doctors as identifying gangrene among the complications resulting from COVID infections in the country.
And joining us now to discuss the latest with the pandemic is emergency physician at the Johns Hopkins University, Dr. Gabe Kellen. Dr. Kellen, thank you so much for being here. So the CDC is warning that unvaccinated areas in the U.S. could become hotspots for a new mutation of the coronavirus first detected in India. First of all, what's your reaction to that?
Well, anything's possible, and we do know that the mRNA vaccines are apparently pretty good if you get 2 shots against this Indian variant. So yes, anybody who live in pockets where there's very low levels of either previous infection or vaccination, this is going to be smoldering throughout the country and throughout the world, even in places that have high rates of vaccination overall, because to some extent, herd immunity is a local phenomenon, not just a general country phenomenon.
Well, so what about in other countries where, the vast majority of countries around the world where populations don't have access to mRNA vaccines?
Well, you may recall, many, many months ago when we started this series, we talked about the proper interpretation of the curve. This is a smoldering fire, and one way or another, people are going to get infected. You can hide, you can run, but one way or another, this virus is going to find a good number of people in any population anywhere in the world. And you will get immunity either from natural infection or you'll get immunity from vaccination. And it doesn't matter which of these variants it is, except that some variants may be so different than whatever you got infected with that the whole cycle starts all over again. One way or another, you are going to be exposed either via vaccine or via the true virus.
So Dr. Kellen, how should people be thinking about that then in terms of behavior? I mean, we're very close to the unofficial start of summer, right? And we're seeing more and more people going out and congregating without masks on. I mean, should people potentially reconsider, take a step back?
Well, I think some of us thought the CDC came out a tad early on their recommendations, but it is summer, and summer tends to be humid in many parts of the U.S. The virus doesn't like heat or humidity, and more of us are outdoors. And in this country, we are actually pretty close to herd immunity in that, we know that at least 10% of the population has been officially infected with COVID, and at least 2 or 3 times that many have come in contact with it and may or may not have come to attention. And among adults, we have a very high rate of at least first shot. So we're very, very close, if not there now, with herd immunity. And that's why the rates overall in the US are dropping. But other countries, some still don't even have vaccine. And so as this starts to spread, we just see these smoldering hotspots, and some are very huge flares like in India, because there just aren't enough people previously infected, and there aren't enough people who have access to the vaccine yet.
Dr. Kellen, over the last 14 days, new cases down 38%, new deaths down 15%. This according to data from the New York Times. New deaths yesterday, just 189. Given where we are with vaccines, what you mentioned about the way that people have been infected who haven't yet been vaccinated, here in the U.S., is the pandemic over?
Great question. So I quasi-answered it with my last statement and from your previous question. This pandemic is never going to be totally over, particularly because it'll just keep coming around, and there'll always be pockets of people who don't have natural immunity from previous infection or have gotten vaccinated, or the mutation is enough to make you sick. What we're hoping for is even new variants, even if they make you sick and you've been vaccinated before or infected before, that the level of infection is mild, meaning not a lot of people go to hospital or die. Remember, even in influenza, which we sort of accept every year, about 50–60% of the population are vaccinated, but 20 to 60,000 people die of influenza every year. And although we'd like to see that decrease, that's just a sticky type of number. So at this point, because of the huge vaccination uptake, and even though it's not what we're hoping for, 70–80%, but given how many people probably have natural infection in the background who haven't been vaccinated, we're pretty close to herd immunity now. And that's probably why we're seeing this decrease, along with the summer, as I mentioned, and being outdoors and so forth.
So Dr. Kellen, also this morning we heard from New York City Mayor Bill de Blasio. He announced that beginning in September, students will not have a remote learning option. They'll be going back to school full time. Considering what you just said, is this the right decision for the largest public school district in the country? And do you expect other school districts across the country to follow suit?
Almost for sure, other districts will follow suit. An unusual step for New York and New York City, given that it's largely a blue state. This would not be a surprise in a red state. You know, it's not like children can't get sick and get very sick and die and even have so-called long haul syndrome. But children don't spread the disease very much, especially the younger children. And given the rate of now immunity, again, natural or vaccinated amongst adults, going back to school is probably not the same safety issue as it might have been 3–4 months ago. So it's, you know, you have to balance, as many people have been saying, you really do have to balance the pluses and minuses here. And you can't keep kids out of school and in remote learning forever and ever and ever. It's just not the way society is built. So no decision is absolute. It's not an unreasoned decision, though.
Dr. Kellen, there's renewed debate this morning, or discussion, I should say, not necessarily debate, about the origins of COVID-19, largely in part due to Wall Street Journal story that came out yesterday that talked about intelligence of 6 staff at Wuhan lab fuels debate on the origin of COVID-19. I'm wondering, from your scientific perspective, from your medical perspective, will we have the data and technology to ever be able to say the origin of this with certainty?
Probably not, but not because we don't have the technology. It's more because we're probably not really going to be able to get at the data. As you know, it was reported that perhaps 3 and now maybe 6 people in one of the major labs in Wuhan, and there's 3 of them, were sick as early as November. Do we have samples of the infection from those people that we could do genomic sequencing? So, you know, to tie it very accurately then to the early infections, and whether you're really going to be able to do that or not, whether it's due to politics or access or lost lab specimens, it's just simply not going to be easy. And then there's the whole conspiracy issue that no matter what is found, it will never be enough for most people to say, oh yeah, it definitely was in the lab, or it definitely was the lab. It's going to be very, very messy.
On the discussion will certainly continue. Emergency physician at the Johns Hopkins University, Dr. Gabe Kellen. Dr. Kellen, thanks so much for joining us live from Baltimore. Really appreciate your time. We should note that the Johns Hopkins Bloomberg School of Public Health, it is supported by Michael R. Bloomberg, founder of Bloomberg LP and Bloomberg Philanthropies.
Up next.